The inflammatory and stress markers like CRP or ESR are not commonly ordered in the ED, but you need to have a rough idea about them. C-reactive protein is an inflammatory marker which increases very quickly in cases of acute inflammation, especially if this inflammation is caused by autoimmune problems. The range should be less than 10 mg per liter. If it increases up to 40, this can indicate some mild inflammatory problems or some viral infections. But if it's as high as 200, this indicates active inflammation, most likely by active autoimmune disorder or active infection, mostly bacterial. But if it's way too high, above 200, this indicates some severe issues, like severe burns, major traumas, or severe sepsis or infections. CRP can be especially useful in indicating the severity of some autoimmune or inflammatory conditions, like rheumatoid arthritis, lupus, or IBDs. And sometimes we use it to monitor the treatment or the response to antibiotics. Erythrocyte sedimentation rate, or ESR, indicates how fast or slow blood goes down a narrow tube. It should be less than 15 mm per hour. It can be an inflammatory indicator, but it's not as sensitive or specific as CRP. It basically indicates how fast blood goes down a narrow tube. So if you have a lot of products in the blood itself, for example, if the blood has a lot of proteins and cells and antibodies, it will go down the tube slower. And this indicates active inflammatory condition. Again, it's not very sensitive, but you need to know it. And just like CRP, we use it to monitor inflammatory conditions like rheumatoid arthritis, temporal arthritis, and lupus. This lecture is part of the emergency medicine course. If you find it useful, you can check out the entire course in the link in the description. The course covers everything that has to do with the emergency department, including tests, imaging studies, common cases, and serious conditions. We also have a lot of cases and quizzes that you can take to test your knowledge. Just check the link in the description.